Welcome to Care, where we have candid conversations about giving care and receiving care.
As experts in psychology, mind body wellness, and caregiver well being, we created a new genre of support for caregivers. We joined the caregiver team, providing individualized tools and resources to help caregivers transform their experience.
I'm Jackie, a licensed clinical psychologist and certified yoga instructor, passionate about providing holistic solutions to transform people's relationship to stress and overwhelm. I love supporting caregivers in navigating the complexities of their roles and returning to their priorities, especially returning to themselves.
And I'm Marcie, a licensed clinical psychologist and expert in neuropsychology, on a mission to help caregivers notice where they're stuck and work together with them to identify and build strategies to get unstuck. When I was suddenly diagnosed with breast cancer, a whole new perspective was introduced to caregiving care. From caregiver expert to care recipient, I found myself in a unique position to bridge the gap between the experience of providing care and receiving care.
Join us on a journey examining different caregiving topics and experiences in which we draw from both our professional expertise and now very personal experience. Full disclosure, caregiving struggles just got a lot more personal. Okay, so we're back, and today we're going to be talking on Care about answering the question, how are you? So I will turn it over to Marcie first, and maybe I should start by asking you, Marcie, how are you?
Today I'm good, which has been my go-to response when people ask me that. I take it right down to like this very moment.
Yeah.
Um, I did not realize how much I dislike that question, how are you, until I was diagnosed. And every time somebody asked it, I wanted to say, like, I'm unwell,
Um,
permanently, temporarily, permanently unwell.
yeah. How right now, and I guess this is like you being in that other side of the role, right? Like care recipient, we'll say here, being asked that question. How often do you feel like you're asked that question?
I mean, every day. And I realized, like, I never realized the frequency and how much I ask it of other people. It's like you say, "Hi, how are you?" That's like the phrase that we use in our society to just be like, "Hi, I'm checking in," or like, "Hi, I'm acknowledging your presence." And like it feels really weird to just say like, "Hi," without anything else. But very few people want to know, like, really, how are you? And even people who do, and I think there are many people who ask me, "How are you?" who like genuinely want to know how I am, but it's just like too much to get into.
Yeah.
So it's something that I've struggled with a ton, and I've been like trying to experiment with different phrases, or like different things to ask people, and I'm terrible at it. Like it's such an ingrained habit to be like,
Like
"Hi."
you're trying to ask a different question just because you are so used to hearing it and feeling like this is not the right question. So you're trying to basically find something different to ask people.
Exactly.
Got it.
Yeah, as like a little experiment for myself, and also because like I realized how frustrating it is for me, and I'm like, okay, I don't want to perpetuate that.
Yeah.
Um, but it's been massively hard. Like you wouldn't think it's such a challenge, but like that's just what we're programmed almost to say, it feels like. And I was talking to my mom about it, and because I was like curious, like, what's it like for you when people are like, how are you? And she had a couple things to say. Um, she was like, do people really want to know how I am? Because if so, like, I can just look them in the face and say, I'm terrible. My daughter has cancer. Like, is that what they want to hear? No. So I just like say I'm fine or say whatever it is I say to like move on from the situation.
Does it feel like energetically draining for you, or even, I don't know if your mom mentioned, to try to respond to that question?
Oh yeah. Yeah, because it feels like you're being, at least my experience is like if I say I'm fine or I'm good, then I'm not being like it doesn't feel genuine. But if I say I'm unwell, then it's just like not socially what is expected from that, right? Like if somebody at a coffee shop is like, "Hey, how you doing?" and I'm like, "Terrible." That's uncomfortable.
Yeah. Yeah.
Which isn't necessarily a problem, but it hasn't been that approach hasn't worked for me. Like I think that that potentially could work for people to just be like, I'm not well, period. And like that could be fine. And also like that, I just like can't do that for
Yeah,
myself.
it doesn't feel like a genuine representation of just like your personality, how you want to like show up with people. And right, I guess the other thing is like, does that beg more questions like then for people to follow up? And then is that energetically draining to explain? And I mean, maybe like the coffee shop stranger example is one extreme, but like, think about like me or your other friends, right? Or like cousins or family who maybe aren't there with you every single day. They don't even need to ask you the question. Those people who are there maybe every single day, right? Maybe that's different. But like for friends, cousins, people who aren't seeing all of the ins and outs all of the time, like they're going to ask you more follow-up questions if you say anything, really. So like, is that also hard, or what's that been like?
Yeah. Yeah. I mean, because there's a definite sort of like calculation that I have to make. Like, okay, do I want to get into it? And so there's just like this constant struggle of like, okay, well, like, how do I represent myself in a way that like feels genuine and in line with like the way I want to be, right? Like, I want to be kind and I want to be, you know, thoughtful and I want to be like responsive. And also, like, I want to protect myself and like not necessarily dive in to everything that's going on.
Yeah. And I have to imagine, sometimes it probably feels like this is too big of a distraction for me to get into all of that right now when I'm trying to focus on this other thing, right? Like if you're trying to get work done, or, if you are feeling well enough to engage in something else, do you want to use the energy to go down this path and explain, really explain kind of genuinely how you're doing or where things are at?
Yeah, yeah. So it's been hard and like it was something I was just so surprised by that like this small question. Hey, Dunk.
We have a cat visitor. She would
Uh,
never ask you how you are.
no, never. She communicates in other ways. But it was just surprising to me, honestly, that like this small question, like how irritating I found it and I find it. And it's like hard because other people, right? They don't know necessarily that that's like the effect that asking, how are you, is having. But like when you're going through something or taking care of someone, like, and you're not, like, you don't have an easy response to that that feels genuine, I feel like it can just be such a draining question and start a spiral. Like I was talking with one of the caregivers that we've worked with and she was saying that like she just lost it the other day and just like basically told the person she was interacting with like stop asking me, and like that didn't feel good either.
Yeah.
um Especially knowing that like the person, where the person is coming from, it's like knowing that we're giving them the benefit of the doubt that like in asking how are you, like they're coming from a good place and like a place of concern. um so it's really really challenging.
Yeah. For you, and I guess like your mom, or even for the caregiver we worked with, like anybody else that you've talked to about this, I mean, I have a couple questions. One is, has it been helpful, like knowing like, okay, you're going to get that question. Obviously, that's, you've been getting it, so like it's a given, you're going to keep getting it. Is it helpful for you to have like what your script is? Like, do you have a couple scripts for yourself where it's like, if it's this level of friendship, or if I have this amount of time or this energy to dive into it, I'll say this. If it's, I'm trying to focus on other things right now, I'm gonna say this.
Yeah, so for me, the thing that I found to be most helpful is narrowing the time frame in my mind of like what are we talking about? So sort of what I was saying at the beginning, rather than like receiving the how are you question as like globally, how are you? Interpreting it as like how am I today?
Mm-hmm.
Um, and allowed that's allowed me to be able to evaluate sort of on a smaller scale, like how am I doing, which feels less draining and less overwhelming. So if somebody's like, how are you? I'll respond, I'm doing blank today. Like I'm doing well today, or I'm feeling tired today, or, you know, I'm doing okay today. Um, that's been helpful to me. And I think honestly, like there have been times that I've even reduced it further to like the moment
Yeah.
that I'm in. So somebody will say, like, how are you? And I'll say, like, I'm okay right now.
Yeah.
And it kind of just helps for me at least, it's helped like reduce that like feeling of overwhelm of like being of receiving such a big question kind of offhand, if that makes
Yeah.
sense.
Sure. A question that used to be just like anything, just like your natural, like, good, how are you? Right. And now it's
Mhm.
like, this has so much more meaning, and to feel like you're being you, to like being true to yourself. It's like, how do I balance that answer while still taking care of myself, so that I'm not going down this path of energetically draining myself, or getting engaged in a conversation that this person isn't expecting, right? And then you also still feel even more drained. So I think that's a really great tip, right? It's like, I think how you said it, like narrowing the time frame of which you're responding to that question. Like you're
Mhm.
not answering the question, how am I, once and for all. You're answering the question like, at this moment, this is how I am. Or today, overall, this is how I am.
Yeah, yeah, exactly. And sort of a similar approach that I was actually talking about this with some other colleagues because we all got on a Zoom call and I was like in the middle of like really hating on the are you question. And somebody was like said, how are you? And I was like, oh, that question. Like, obviously, it's like colleagues that I felt comfortable with. And it like opened this conversation. And it was actually super interesting. One of my colleagues was like, I answer that question just for the context of the thing that I'm doing. So, like, for example, if I'm going into a meeting, right? And somebody says, how are you? Well, in the context of this meeting, like of coming here, of meeting with you, like, I'm fine. Like, there might be stuff going on in my health or in my family life or whatever that, like, I'm not fine, but like in the context of this, right? I'm fine or I'm doing, I'm good. In the context of grabbing a coffee, I'm good.
Mhm, mhm.
So again, sort of like it in my brain, narrowing the time frame has been helpful, but I think similarly, like reducing the context can be useful,
Yeah.
um, a useful strategy. Um, Another thing that's been helpful to me, I mean, I've been playing around with lots of different like phrases of
Yeah.
things to ask and honestly it's so hard to nothing like it's hard to get it to stick, but I'm persevering. Um
What kinds of things?
so the big one that I've landed on is I'll ask rather than saying how are you, I'll say what are you up to make it more about like the person's action and like behavior in that moment or in that day rather than like the associated emotion or feeling
Yeah.
around.
That's a great idea. Like, what are you up to? And like people can interpret that like there's more options then basically. It gives you more options of like how to proceed. And it can also simplify your decision making on what to say because you could just look at like what am I doing right now? Like having a conversation.
Yeah, yeah. And so like I'll call, my sister or my mom and I'll be like, and rather than saying like, hey, how are you? I'll say like, hey, what are you up to? And so like that's been like a slight change that I've made. Another one is how's it going? Which is also like pretty nuanced, like just a little bit different than how are you? But it's taking again the focus off of like you and right, like the subject of the sub sentence, maybe not grammar. I don't know if like technically it's the subject, but like the focus of the sentence, oh my gosh, words, um, becomes it. So like how's it going? And it can kind of be whatever. Like things are fine, or oh, I'm having a really annoying day, or you know, I things are fantastic. Like it's everything's going well, whatever it may be. But for some reason, like that slight change from like how are you to like how's it going, I find more palatable. I
Yeah.
don't know if that makes any sense or if it's just a total like, idiosyncrasy, but
No, I think it makes so much sense. I mean, and you already kind of brought this up because you're talking about like from your mom's perspective. I guess even more broadly, like how do you think that this comes up for caregivers? Like, do you think it's the same way? Do you think these things would apply, like these kinds of strategies?
yeah, yeah, no, absolutely. And like I've talked about it with my mom and with my sister, and like everyone agrees that like the how are you question is just like it's an empty question in a lot of ways. And like in other circumstances, when like things are globally pretty good, it doesn't bother people
For
because,
sure.
it's just a greeting in a lot of ways.
Yeah.
But when circumstances change and things globally are no longer really going well, there just feels like a much more weighted question. It doesn't feel like a throwaway question, and so it becomes or it can become like uncomfortable to answer.
Yeah. Yeah. Because it's like if I say great, but what I mean is I'm great right now, like that tells you nothing, or maybe it's even confusing to you about like that I think life is great right now when like objectively, right? Like there's all of this stuff going on that is not great. So again, like I feel like especially for you and this has definitely come up with the caregivers we've worked with, which is like how to have conversations, whether it's with the care recipient or other people about the person you're caring for in a way that like preserves your energy and is still genuinely you, right? Like I care about being warm and kind and understanding and approachable. And what I really want to say, like, would not come off that way, right? So how do I strike that balance? So it's both. Like I'm preserving my energy and I'm still being me.
Yeah. Yeah. And I think for me, like having a couple phrases that I just have replaced how are you with and like replaced it very imperfectly because like I said, it's so ingrained. Um, but has been really helpful and also just like kind of tweaking my perspective on the question itself, like modifying my response accordingly. So like I'm good today. How's your day going is something I might say, like bringing it down, bringing the scope of time down for me and the person I'm having a conversation with. Um, I've also kind of defaulted a lot to like I'm okay just because that's like neutral,
Yeah.
feels neutral to me.
Yeah.
Um, but honestly, even more than like being asked that question, it's asking that question that like has become so frustrating to me because like I get frustrated with myself for asking it.
Yeah.
Um, knowing that like it's a learned behavior, but still.
Yeah. Yeah. Right. Like you said, it's a greeting. I mean, that really is like what it's become. And it probably takes practice to change that. I mean, definitely like I'll be thinking about that now as I move forward. And when you said, what are you up to? I was just thinking, I think you texted me that this weekend. And it like struck me because I was like, it made me think like, what am I doing right now? Like it made me think differently than just being like, good, how are you? Right? Like,
Yeah. Yeah. It's just like a slight change. And honestly, the first place that like I even thought about this at all was in the context of therapy because when we had like in graduate school when we had a communal waiting room I like never felt comfortable in the waiting room saying to a client like hey how are you because
yeah, yeah,
like and so I like very consciously changed my greeting to like hi it's good to see you
yeah,
and that was like the first time so I'll say that even sometimes too like if I see someone and they say like hey how are you I'll just respond like hey it's good to see you
yeah,
um but yeah, sort of having some of that alternative language, I think can be helpful, especially because it is like I know from now being a care recipient and also talking with my mom and my sister and my husband and the people around me and working with the caregivers that we've worked with that like it seems like such a small throwaway question, right? How are you? It's exhausting.
Ah,
So,
yeah. Yeah. I mean, those are really good tips. And I think I don't know if people call it this or if I call it this in my head, but hallway talk. It's like, what do you say to the client while you're walking them down the hallway, right? You're not going to get into the full conversation. I mean, in the context of like, being a psychologist, this is going to be confidential. So you're not going to want to invite that conversation to happen outside of the closed doors.
right.
But it's kind of the same thing, right? It's almost like, how do I kind of figure out how to be genuine and like have the hallway talk? And then that conversation of how are you? It's not like it needs to be probably completely off the table, but it has to be saved for like really meaningful times, right? When like mutually it's ready to be discussed, basically. Because I
Mm-hmm.
mean, I'm imagining, and from our conversations, like obviously you do talk about like emotionally what's going on and things like that too. But to constantly be faced with that question, especially when the assumption is this is a throwaway question, that's where it becomes a whole puzzle that you're trying to solve. And that's when it becomes energetically draining. So I think the ideas of like identifying, right, the how to narrow the time and the context, and just being like really aware of how then you ask the question, because that can change where the conversation goes. And then having some of those scripts for yourself, kind of like you said, like you kind of keep some things in mind. And I know that's something we've helped people with before in navigating uncomfortable conversations. Is like, what are some scripts I could have ready so I don't have to reinvent the wheel every time?
Mm-hmm. Yeah. Yeah. No, I think that's a great summary of it.
Yeah. Awesome. Well, anything else right now? I'm sure we'll have more on this to come as you're asked that question more. And as I find myself, like, I'll probably ask you that question and be like, no, did it again.
And like, I don't get mad. It's really like, I don't feel that irritated with others as much as myself when I ask it, just because like I recognize just like how big of a question it is.
Yeah. Yeah.
Um, but yeah, no, I hope those are helpful takeaways for people. And yeah, I'm sure we'll talk more about how we're doing as this series unfolds. In the meantime, I hope that people can like and subscribe to our channel.
Yeah.
Um, and I'm excited to reconvene for our next episode.
Yeah. Sounds good. All right.